Hello, I'm Pinellas County Schools Superintendent Michael Grego. Thank you for continuing to support the students and families of Pinellas County. As vaccines become more available, we know people have many questions and concerns. In order to answer some of the most frequently asked questions, I assembled members of the district's medical advisory group to share facts with our staff and community. This group has been working with us so effectively since March of 2020 and has consistently provided the most up-to-date medical advice, which has enabled the district to lead with the health and safety of our employees, students, and school community. Joining us today, we have Dr. Yuli Cho, Director of the Florida Department of Health in Pinellas, Dr. Allison Messina, Chair of the Division of Infectious Disease at Johns Hopkins All Children's Hospital, Dr. Nichelle Threadgill, Chief Medical Officer for Community Health Centers of Pinellas, and Dr. Robert Kopak, Infectious Disease Specialist with Baycare Health System. Let me begin the questioning perhaps with Dr. Cho as the head of the Department of Health in Pinellas. And Dr. Cho, if you could just tell us a little bit about the status of the virus and the status of the vaccine and what's been approved, what's available to the employees of Pinellas County School District.
Thank you for having me. So this week, we mark the 1-year anniversary of the first case in Pinellas County. So it's been a long year. So in terms of the trends, we've seen a few peaks throughout this course. And currently, over the last few weeks, the good news is our numbers have decreased. We're down to our 7-day case count of 187 cases daily, our 7-day percent positivity. That is the percent of people that are of a given test, how many of those in a particular day is positive, and it's at 4.6%. In terms of death throughout this pandemic, we've seen, unfortunately, 1,481 deaths here in Pinellas County. So we hope that in terms of our trends, that these continue to go trend in the right direction. One thing that we are watching, you've probably seen the talks about the variants in the news. The state of Florida, as well as the CDC, does track these variant strains of COVID-19 at a state level. And to date, there has been 642 UK variants, 5 Brazilian variants, and 1 South African variant here in the state of Florida. And the significance of these variants is at least the latter two, specifically the Brazilian and the South African variant. They can be less effective, that the vaccine can be less effective for these particular strains, and we can certainly talk about that more. Obviously, the biggest component of our response now to the COVID-19 pandemic is the vaccine response. Currently, there are 3 EUA-approved vaccines out there. To date, we have vaccinated 172,293 individuals in Pinellas County, at least receiving their first dose. So that roughly translates to about 17.4% of the population. I think that's a good start, but we certainly have a lot more room to go.
Thank you, Dr. Cho. And let me open it up to, as we proceed with the questions, we'll open it up to any of the panelists. Thank you for that overview of our district. One of the more common questions that you and I are faced with is this: is the vaccine safe, and can you still get the COVID-19 after receiving the vaccine? I'll throw that out to any of our panelists.
So I can address the safety of the vaccines as well as the efficacy by just kind of describing how each of the vaccines came to be. And each of the vaccines that we're talking about that are available right now did go through phase 3 randomized controlled placebo-controlled trials, just the way any vaccine does. So even though these vaccines were developed on a short timeline, from the time that we knew the virus existed to the time we had a vaccine was less than a year, but it doesn't mean that any corners were cut in terms of whether vaccines were studied. And now that we have millions of doses out there, every day we get more and more safety data. The vaccines are safe. The side effects that we do see with these vaccines are generally mild and uncomfortable, but not dangerous symptoms. The efficacy of each of the vaccines is excellent. The Moderna and the Pfizer vaccine protect against symptomatic COVID disease at about 95% after your second dose. The Johnson & Johnson vaccine is a little bit less than that. In the US was around 72%, but all of them, including the Johnson & Johnson vaccine, were very, very effective against severe COVID disease. So really, when you consider what you really, really need a vaccine to do, you need it to keep people out of the hospital and hopefully to prevent them from dying. And all of the vaccines do that beautifully. So that's kind of where we are now. So we have 3 very good options.
Yeah, to add on to that, there was almost like apples and oranges that they were with the Pfizer and Moderna vaccines versus the Johnson & Johnson. Johnson & Johnson actually was very specific in terms of defining who were moderately and severely ill patients. And so the efficacy globally for the Johnson & Johnson was actually 85% against severe and critical disease, which is exactly what Dr. Messina was talking about. You want to keep patients out of the hospital, off ventilators, and keep them from dying. And no patients, I believe, in any of the trials that were in the treatment arms had any deaths. So that's really important to know.
Yeah, I would just add with the efficacy, I hear a lot of conversation with patients and people in the community with the concern with comparing that 90% that you hear efficacy after 2 doses versus the 1 dose with the Johnson & Johnson. However, we do have to keep in mind that those trials were done at different times. And so when Johnson & Johnson's trials were taking place, we did have quite a few known variants already circulating within the community, where we had much fewer variants back when Moderna and Pfizer trials were taking place early on. And so again, another reason why you cannot compare head to head those vaccines, because they were not paired against each other in comparison, and they had a different type of environment during the time that the trials took place. But definitely to reiterate that all 3 vaccines are super effective against preventing severe disease, hospitalization, and death, which is ultimately the goal of a vaccine.
Well, thank you. And Dr. Cho mentioned about different strands of the COVID-19 virus. Can anyone comment to the efficacy of this vaccine to perhaps these other strands, and how do you answer those types of questions? Is it effective?
So we have, it's a tricky question to answer because you have to kind of go look at each vaccine. So Dr. Threadgill was correct in that since the Johnson & Johnson vaccine was the most recently studied vaccine, that's the vaccine that we have the most real life data for in terms of how well it does against these variant strains. We do know from the Johnson & Johnson trials that, and because that trial was done in different countries, we know that the efficacy of that vaccine was less in South Africa, where the South African variant, B351 variant, is the primary circulating strain. However, even in South Africa, the vaccine still did very well against severe and hospitalized disease. So even if you take the toughest to vaccinate right now strain, the Johnson & Johnson vaccine still protected those people from going to the hospital and dying. So that's great news. Now, we don't have that kind of data with Pfizer and Moderna yet because they weren't studied during that time at which you see all those variant strains. there is some laboratory evidence where you can look at in the lab how well Pfizer and Moderna vaccine might do against some of those variants, and we still think it's probably going to be effective, but that real world data isn't quite there yet. So I think that we can probably say that some of these variants are, the vaccine doesn't work quite as well, but still hopefully at this point in time, well enough to keep you out of the hospital and well enough to keep you from dying from this virus.
I guess I would also add, of course, this has not been studied, but when you pair vaccine and your continued use of your mask and your continued social distancing, so all of the behaviors that we know that help limit spread of infection and risk of contracting infection, the vaccine certainly adds a benefit to that.
As more and more people get vaccinated, they all come back with their stories about what side effects could I expect. And so from the medical panelists that we have here, what side effects could people expect? And I know everyone's going to be different, but what would your answer be?
Yeah, I think that first of all, it's important to remember that your immune system is designed to recognize things and respond. And so it's always a good thing when you really think about it to have a reaction. But most commonly what I am hearing are, body aches, pain, redness, and soreness at the injection site. And sometimes fever and headaches are the more common adverse effects that I have identified.
Yes. Yeah. Go ahead, Dr. Messina.
Sorry. Yeah, and I think that another thing that's really important to recognize too is when you get, if you do end up getting either the Pfizer or Moderna, the vaccines that are a 2-dose series, those effects that you feel are worse generally speaking, after the second dose than after the first dose. And that is exactly because of what Dr. Threadgill was describing. That's your immune response to the antigen, what we call the foreign protein, which the vaccine delivers, and then you make an antibody to it. Well, in that process of your immune system recognizing that antigen, you start to feel these symptoms, and they are the most common are headache, fatigue, chills, joint pain, and even sometimes fever in some people. I will say though, if you have had COVID before, the actual disease, and recovered from COVID, then your first vaccine might give you those same reaction, that little bit of a revved up reaction because your immune system has seen it before. Generally speaking, these side effects are uncomfortable, but not dangerous. And they usually last anywhere from about 24 to 48 hours. So it's relatively short-lived.
I was just going to add that with younger adults who seem to have a more robust immune response, they're the ones that have reported more side effects than older adults. So that's something to look out for. It doesn't mean that if you don't have any reactions that it's not working. It just means that immediate immune response was a little bit more brisk in some of the younger individuals that received the vaccine.
I would even argue that if you have these sort of common side effects from the vaccine, you would have had it if you developed natural infection. And then the beauty of it is that even if you have those symptoms, you still get the added protection of getting that vaccine and having that long-term protection, longer than even to some degree natural infection. So it's not in terms of the side effects, shouldn't be the biggest driver as to whether you take the vaccine, because you would have had them anyways with the natural infection.
Yes, definitely. The only other thing that I probably want to stress though is that if you know you're going to, or it's likely that you might have symptoms, especially the day after your second vaccine, if you can kind of plan your work schedule accordingly, that's really helpful. For example, we had to make sure that the entire emergency room staff didn't all get vaccinated on the same day because we didn't want everybody out at once. So you may have to sort of stagger your schedules a little bit, sort of anticipating that some folks might not want to come to work the day after, especially their second vaccine.
And I think that it's important to add that the only one contraindication to vaccines is a severe reaction to a severe allergic reaction to a component of the vaccine. And so an allergic response is the one that we all worry about, and it is the reason for that observation period after the vaccine, although that one is much mild, much seen less often. And so it's certainly not as frequently identified.
Well, great job answering that question. The CDC just came out with some updated guidelines for individuals who have been fully vaccinated. And what do people need to know about these measures and what mitigation effects still need to be taken?
Yes, that's an excellent question. So myself and my wife are both fully vaccinated, which is great. And we've gone 2 weeks beyond the last vaccination. So as per CDC guidelines right now, we're able to meet with very small groups indoors without a mask if we choose, as long as the other people in our group are also vaccinated. So that's the one new thing that did come out from the CDC. That gives a little bit of leeway to people who have been fully vaccinated. However, the thing is that wherever you may go, and the bigger the groups become, you don't know what the other person if they are vaccinated or not, and who they've been in contact with or not. So it's with a small grain of salt that we take those recommendations right now. And still, if we're in a group where we don't know the other people, best to wear your mask and to keep your social distance at this time.
Yeah, I would also just say that, prevalence of vaccine, it's still, we have not vaccinated as many people as we would like to. And so certainly continuing a lot of those risk mitigation behaviors that we've talked about throughout the pandemic, I think is still very important.
If I've already had COVID-19 and recovered, do I still need to receive the vaccine?
So I would say, yeah, well, the short answer is yes, you really should consider getting vaccinated. And the reason is because when you're infected naturally, you don't ever really know what kind of a dose of virus you got. For example, if you didn't get if you were one of those lucky people who didn't get very sick, let's say with your actual infection, it is possible that your immune response might not be super robust, and we don't know how long lasting. So we know that from the studies where they, looked at people's immune response who had received vaccine after those especially after the second dose of either the Pfizer or Moderna vaccine, the antibody levels were a lot higher than people who had had natural infection on average, not to every person, but on average. So since you don't really know how robust your immune response was after your natural infection, it certainly doesn't hurt to get vaccinated. There's no contraindication to it. It isn't dangerous at all. And the benefit that you get is that you have now a very robust immune response. I believe it was even the Moderna trial that actually did have a small percentage of people in that trial who had been previously vaccinated, and their efficacy once they got vaccinated was 100%. So now it was a very small group, and it's hard to say how you can generalize that over a population, but we do know that the vaccines work very well, especially in patients who have had COVID before. So since there is no contraindication, and since it can only help you, I would recommend that if you did recover from COVID, that you still consider getting vaccinated.
Yes, and it also depends on how early you were exposed to the virus as well. You may have been exposed to one of the wild type variants and not necessarily to one of the newer variants that may be circulating now. So that's also a good point to make. And Dr. Messina, to your statement, I was one of those that was early on one of the unlucky ones and was very symptomatic. And I did receive the vaccination, like I said, and the immune response was very robust each time after the vaccine. So it's something that definitely did not persuade me not to get it. I'm very happy to be fully vaccinated now, and hopefully the variants will stay away. And the more people that are vaccinated, the less those variants will come about. So that's something also to kind of let the public know that we need to get as many people vaccinated as quickly as possible.
Can you discuss the effectiveness and the timeline of the vaccine? We know that right after you get vaccinated, it doesn't take full effect to become fully effective. So can you discuss a little bit of the timeline, and also maybe how long does the protection from the vaccine last, if we know that at this time?
Yeah. So go ahead, Dr. Cho.
So the CDC doesn't consider you fully protected with the vaccine until about 14 days out from either the second dose for the Moderna and the Pfizer vaccine, or 14 days out from the single Johnson & Johnson vaccine. That it does require that kind of time frame for the antibodies to develop in your body and provide that level of protection. I'll stop there. There was a second part of the question. I'm forgetting.
How long does the protection last, or do we know that at this time?
No, unfortunately, at this time, unless my colleagues I think otherwise, there hasn't been enough data. It hasn't been out long enough to know the longevity. There are some thoughts, just in terms of full disclosure, that it may require booster, whether it's a year out or 2 years out. That's to be determined. I know a few of the pharmaceutical companies are looking at a booster to maybe potentially cover those variants that we discussed as well.
They're being followed for, I think it's up to 2 years, at least in the Pfizer and Moderna trial. So those folks are actually getting their antibodies tested periodically to kind of see how long they persist. Remember the virus itself was only discovered slightly over a year ago. So you really can't know that long-term data, because the very first people to be vaccinated at all were vaccinated probably sometime in the summer of 2020. So those are the earliest folks that were vaccinated. So we'll be getting that information, but we don't know. We can't really look into the future at this point. So that data is yet to come.
Dr. Cho, go ahead.
Yeah, I was just going to say, as per the CDC guidelines right now, your immunity is thought to be for at least 90 days. So they kind of give a time frame of 3 months, but more likely than not, it's probably a little bit longer, but hard to say if it goes out for the full year. So the durability is yet to be known.
Dr. Cho, we'll give you an easy question because just for our audience and people who wonder, does the vaccine cost anything for our employees or the citizens of Pinellas County?
The vaccine is at no cost. I know at the federal government level, they put a lot of investment into it, so there should be no cost with the vaccine. I believe in certain sites they may charge your insurance company to collect that information, but in terms of the cost to you directly, either with a copay or for the cost of vaccine, that is not the case. It is at no cost.
Good, thank you. We also have Sarah O'Toole, who's the managing officer of our school health services here in Pinellas County. I want to ask Sarah, and also a huge shout out and thank you to Johns Hopkins All Children's Hospital, who vaccinated all of our nurses in our schools. And maybe, Sarah, you could tell the audience a little bit about that experience.
Sure. Thank you. Yes, so I was contacted by Johns Hopkins All Children's Hospital, which we have a longstanding partnership with them, and they graciously offered to provide the 2-dose Moderna vaccines to the school health staff. As we all know, the school healthcare professionals are in the first wave of vaccination groups, and of course, in the schools, they are the frontline people who see all the sick children who come and sick staff members who come to school. And so through a process with worked out by Johns Hopkins All Children's, we did successfully vaccinate many of the school health staff. It was a very simple process. They set us up online. We made our appointments online. The second appointment was done all online as well. And the process itself was very smooth and easy to get through. As far as the side effects, we had some discussion about the side effects. As a group, my staff did experience side effects. Like was mentioned earlier in the conversation, those who had had COVID previously did have a more robust immune response to the first dose, and then also to the second dose. Anecdotally speaking, and even personally, the side effects from the second dose they're uncomfortable, not unmanageable. You certainly can manage them. And I just kept telling myself it was certainly better than being down for the count with COVID. And so I would like to publicly thank the hospital for their generosity for including us in their allotment of vaccinations and thinking about us, because we are sometimes a population that can get overlooked a little bit. So I really do appreciate them publicly. I would like to thank them for that.
Thank you, Sarah, and thank you to Johns Hopkins All Children's Hospital for that. And we never overlook our nurses, by the way, Sarah. So with that, I want to remind the audience that we have a feature on our website. It's called Let's Talk. So after you listen to this, if you have any questions, additional questions, we'll route these questions either through Sarah or through this medical panel for answers. And it's been proven to be very, very effective. With that, I want to ask and just have a roundtable of discussions, anything that perhaps we've left out with the doctors that we have on our panel. Any final comments, any suggestions, encouragement, or any bits of information that perhaps we didn't cover? And let's start with Dr. Kopak. And thank you to also Baycare for your service on this committee, Dr. Kopak. Any other comments that you'd like to make to our employees?
No, just to say thank you for everything that they do every day in the schools, because it's really important to keep the kids in school, to keep them educated. It's been a rough year for both the teachers and the students. And so now that we do have the vaccine available, if we can get as many teachers vaccinated, then that will be helpful for all of the students, because it's easier for the students in terms of being at less risk of having severe disease for the student body, but for any of the teachers, for them to come down with COVID could be life-threatening. So it's important to keep everybody safe and to try to get back to normal as soon as we can. Thank you.
Thank you. Thank you, Dr. Kopak. Dr. Threadgill.
Yeah, so I certainly want to maybe talk a little bit about vaccine hesitancy and a little bit about equity and distribution of the vaccine throughout the community. I think there is a lot of concern about the production of the vaccine and how fast things kind of moved with production of the vaccine, which certainly makes people feel a little uneasy about something that's new. And then, of course, if you hinge that on some of the historic issues with research and other things that have happened in history, the Tuskegee experiment and all of those things, there's a lot of people in our communities who are really reluctant, worried, hesitant to get vaccinated. Hopefully, through these discussions, they're able to understand that science has been followed, safety standards have been followed. There is no abbreviation in phase trials. The trials included a diverse amount of people, so different ethnicities, different health conditions. And so the vaccine has really proven to be safe and effective. And so the way to really get through this COVID pandemic, now that we can see the light at the end of the tunnel, is through vaccinations. and utilizing those vaccinations, either of the three, which are all efficacious against severe disease, hospitalization, and death, is highly recommended. And so certainly want to make sure we're addressing any of those types of concerns.
Thank you, Dr. Threadgill. Those are great comments. Thank you very much for your service also on this committee. Dr. Messina?
Yes, thank you. And I want to echo what Dr. Threadgill said. I think that, throughout history, the only way out of, pandemics is really been through vaccination. I mean, smallpox has been eradicated. Measles has been almost eradicated. Polio, you never hear about anymore. All of this was done through vaccination. And so we can do this. It may look a little bit different in that, like Dr. Cho said, we may have to have boosters eventually of this vaccine. It may have to be tweaked a little bit for new variants, but if you can really suppress COVID in the community by mass vaccination, you're going to see less variants because a virus has to replicate in order to mutate. So I think that we really have a huge opportunity to really squash the curve and get those cases down, and that will only, bring us back to normal, hopefully, or near normal more quickly. It will keep people healthier. It will keep people out of the hospital. It will keep people from dying. It'll help our kids get back to school. So, I mean, really, I think take this opportunity. It's such a great opportunity to get vaccinated and to, help yourself and your community get back on track to normal.
Thank you, Dr. Messina. And our final words, Dr. Cho, we leave him to you as the Director of the Department of Health in Pinellas County. So, Dr. Cho.
Well, Dr. Rio and the school board, thank you for putting this program on together. I think it is important to get that messaging and the information out there. I want all of you to consider getting the vaccine. It again, as my colleagues have mentioned, is both safe and effective through rigorous trials. The county, through our partnership, has been able to establish multiple access points where you can get the vaccine. We have community sites doing 20,000 plus vaccines a day. That can be accessed through the CDR Health portal. That website is patientportalfl.com. Even as of today, there's even slots available for this week, so please consider getting your vaccine. You can also get those vaccines at health clinics such as CHC, hospital systems, the pharmacies. So there is a lot of opportunities out there. So please consider getting your vaccine today.
Thank you so much to all our panelists for joining us today and for your ongoing support of Pinellas County School District. Your partnership has been an invaluable resource in keeping our schools open and safe. We appreciate you taking the time to keep our community informed and to give them the information they need to make the best decision for themselves and their families. For the most up-to-date vaccine information, please visit pinellas.floridahealth.gov. Thank you so much.